While the need for blood donations are critical, only about 10% of eligible people donate each year. Plus, there are discriminatory guidelines that make collecting donations even more difficult. Some members of the LGBTQ+ community have certain limitations which stem back to the height of the HIV/AIDS crisis back in the 80s. We're learning more about why an issue from 40 years ago is still having such an impact today. We're joined by Dr. Tim Peterson, who's the medical director of the Louisiana Blood Center. Thank you so much for joining us this morning for this conversation.
Good morning, Sheba. Thank you for having us here.
Yeah, good morning. Listen, a lot of people don't even realize that these restrictions are still in place for certain members of this community.
Well, the FDA in May of 2020, at the very outbreak of the pandemic, revised a lot of the criteria for donation, and they actually shortened the deferral period for many conditions or many risk factors. One of those being men who've had a sexual contact with another male. Prior to May of 2020, it was a indefinite or permanent deferral. Now, currently, it is a 3-month deferral from last contact. And there are many other instances where they have shortened deferral periods or recently have removed many deferral periods for other conditions that are considered risk factors for transfusion transmitted disease.
Right, and this, of course, is progress because up until 2015, there was actually a lifetime ban on men who had sex with men from donating blood.
Yes, it was, and evidence that has come through from European studies, Canadian studies, and FDA studies show that, again, the risk has decreased and that a 3-month deferral period currently would be able to handle any potential infections that might have been present in blood donation.
Okay, it seems, though, a little bit outdated and antiquated just because from a medical perspective, I can't understand, aren't they testing all of the blood they receive, though, to make sure it's free from diseases?
All blood centers are required to do FDA mandated testing. What most people don't understand is that there is something called a window period. That is a time from infection until the time of detection by the test method. So there are cases that have been reported of someone who has been infected with a transfusion transmitted disease, come in, donated blood, and because it was early in the infection, either antibodies or viral particles and cells were not able to be detected by current testing methods, and they were unfortunately transfused to a patient. As you know, sick people get blood, and it can be very difficult, if not deadly, if someone were to receive a unit of blood that did have a transfusion transmitted disease present. So it's the window period that the FDA is currently interested in.
Gotcha. But why are they only interested in that period for men who have sex with men? Because as we know, AIDS or HIV, okay, but the restriction isn't on anyone else though, right?
There are restrictions for people who have used IV drugs. There are restrictions for people who have either participated in sexual contact for money or drugs, or who have also paid for sexual contact with someone. There are restrictions for visiting malaria countries. There are restrictions for medications that could cause deformities in developing children if they were to be given in a blood product to a pregnant woman. So there are numerous restrictions that are in place. The FDA's questionnaire does not ask sexuality of a patient. The FDA's donor questionnaire involves risk factors.
And then I guess what else seems difficult is that this is based on an honor system, because if you're a man having sex with men, but you say on the form that you're not, then you can still donate blood?
It's always based on an honor system.
Do you think there need to be any changes or improvements to the current restrictions that are in place? Or you think they're necessary?
Until we're able to do what we call pathogen inactivation, that's where we're able to treat all blood products to take care of most known and many unknown infectious agents, then there has to be some type of a testing procedure done, and a donor questionnaire has been probably the safest way to maintain a safe and adequate blood supply.
Okay, so what many see as discrimination, you're actually saying you don't see this as discrimination. This is something that is necessary.
Sick people receive blood products, and until we're able to treat all blood components, The FDA requires all blood centers to take methods like this to try to ensure a safe blood supply.
All right. Well, thank you for joining us this morning and helping us understand a little bit more about why that's in place.
Thank you.